Thank you, Minister, and good morning. 1,903 cases yesterday here in Victoria. That takes us to a total of 22,327 active cases of coronavirus across the state. As a result, we also have 61,341 primary close contacts, and my thanks to all those 61,000 people for doing the right thing and doing their isolation and their quarantine period to ensure we minimise wherever possible the ongoing spread of COVID across our community. The geographic spread is very similar to what we've seen over recent weeks. Again, that accelerating trend of cases, particularly within our south-eastern suburbs. In the southeast today, we have 592 cases. That's almost a third of our total cases today. And again, with Casey being the highest LGA today with 188 new cases of coronavirus. Our western suburbs have 519 new cases today. It's just over a quarter. And again, we're seeing a continued slight drop in the proportion of cases in the west. And similarly in the north with 497 cases today. Again, around just over a quarter of all the cases today. And again, a slight reduction in where they've been in recent weeks. We have 106 cases in the eastern suburbs. We have 166 cases across regional Victoria and around 23 cases which are either interstate or we are working through. In terms of regional Victorian cases, we have a total now of 1,635 cases across regional Victoria. It's around just under 9% of all of our new cases, and that proportion of new cases in regional Victoria is slowly increasing day on day on day as we're seeing more of those little spot fires across different parts of our regional communities. We have 38 cases in Geelong, Greater Geelong. Most of those are well understood and connected to known cases or exposure sites. In the Latrobe Valley, we have 29 cases. Some work being done to understand those exact linkages, but again, it's an ongoing growth of the outbreak down there. And in Bulbourshire next door, we have 19 cases. Those numbers are starting to stabilise. Again, household primary close contacts, known associates of the positive cases. In Shepparton, we have 12 cases, particularly involving a couple of schools, as it's a younger cohort of positive cases or cluster of cases in Shepparton. And I'm pleased to confirm that in Mildura we have 9 cases today, and although that's 9 more than we'd like, it is a slowdown of the recent cases we've seen in Mildura. And again, outstanding work being done by local agencies up in Mildura. My thanks to them for their hard work of the last week. Mildura, of course, continues in lockdown at this point in time, and will review their position on a day-to-day basis over the course of this week. We've also seen outbreaks in places like Ballarat, Ararat, Colac and Warrnambool, and a shout out to them because I think they've been really well managed in the community. We've seen, although we've seen cases in a number of workplaces, a number of different household type settings, really swift contact tracing and support by local agencies has managed to contain those very quickly. We don't see any significant onward spread at this point in time. Of course, vaccination, we're now hurtling towards our 70% and 80% double dose targets, and the pace, if anything, is starting to increase. And following yesterday's announcements, we saw a rocketing of double dose bookings, over 31,000 bookings yesterday for people's vaccination slots. And can I please encourage you, if you haven't yet booked in your second dose appointment, please join the thousands that are getting their second doses done today and tomorrow and over this course of this week. The quicker we get those second doses in, the quicker you complete your vaccination journey and have that extra protection, and the quicker the state gets to those 70% and 80% thresholds, now that we can start to see what lies beyond some of those dates. In terms of age groups now, every single age group over the age of 16 is now on more than 80% first dose coverage, and we're seeing the older age groups now well into the mid-90s, 95% of over 70s, just phenomenal levels and continuing to grow every single day. Again, we're seeing a phenomenal performance by younger Victorians. Those 12 to 15-year-olds have only been able to get vaccinated over the last 5 weeks. And in the space of the last 5 weeks, 225,000 young people have got themselves vaccinated. That's almost 3/4 now of 12 to 15-year-olds having had their first dose. That enthusiasm and desire to get vaccinated by younger Victorians is really good to see, and we're very grateful to them for coming forward in such good numbers, many of which I saw at Casey only on Saturday. And also encouragingly, in terms of our second dose performance, all age groups over the age of 40 are now well over 75% second dose. So again, we're just waiting now for the more recent people to catch up on their second dose appointments before we get to that 70 and 80% threshold. We're also seeing good geographic coverage of vaccination levels there are now only 3 local government areas across Victoria where the first dose rate is below 80%, and that's in the city of Yarra, city of Stonington, and the city of Port Phillip. And there are only a further 3 where the first dose vaccination rate is below 85%, and that's in Maribyrnong, Darebin, and Moreland. And when you then break it down to postcode level and sub-postcode level, there are in fact around 25,000 individuals that we're really keen to get vaccinated in a number of very tightly defined geographic areas that straddle over those 6 LGA areas. That's why we've launched our neighbourhood vaccination programme, the mini pops that are coming up everywhere, the school vaccination programmes that are all targeted at those remaining small pockets of relative under-vaccination. We're really keen to get to ensure that those communities do avail themselves of the protection of the vaccine, particularly as we start to step towards those easings at 70 and 80%. There are, for people to get their vaccinations done, as well as the various Walkup facilities that are now available, there are also 40,000 second dose vaccination slots available in the next 7 days. They're available right now, and we'd be delighted if people came forward and got themselves done. And there are also still 25,000 first dose vaccination slots available as well over the next 7 days. Again, we'd really like to see bookings being made. And if you've got a booking, but it's a bit further out and you can bring it forward because the timelines allow you to do so, then please do that as well. Another shout out for our colleagues in community pharmacy. We've now seen over 140,000 Victorians take up the Moderna vaccine, largely through the community pharmacy and through some of our state clinics. So that first dose rate of Moderna has proven to be really effective, and it's a safe and effective mRNA vaccine that people can access. We're now starting our second dose cycles on Moderna. First doses are still available, of course, but we're now also starting our second doses, and there will be thousands of second doses due in the coming weeks. We continue to run our walk-in program at a number of our state vaccination clinics, including at Sandown Racecourse, at the Palm Plaza in Dandenong, at the Bayside Vaccination Centre in Frankston, at our Melton Vaccination Centre, at Jeff Shed, Sunshine Hospital, or Shepperton Showgrounds, or Traralgon Racecourse, or of course any of the 700 community pharmacies around the state who will also do your first or second dose Moderna vaccination for you. Finally, with now 2/3 of adult Victorians being fully vaccinated, and because of the far lower risk of both contracting COVID and passing on COVID, we've now we'll be making a further change to the isolation protocols for primary close contacts from this Thursday, so from our 70% double dose vaccination date. What that means is if you are fully vaccinated, you will only be required to do a 7-day quarantine if you're a primary close contact. So if you're a workplace primary close contact or a social primary close contact of a positive case, but you are fully vaccinated, you'll only need to do a 7-day quarantine rather than a 14-day quarantine from Thursday onwards. If you're currently a primary close contact of somebody, either a workplace or a social primary close contact, and you are fully vaccinated, if you are at day 6 or beyond on Thursday, then you'll be able to go and get your final test, your closeout test, and if that test is negative, you'll be released from your quarantine period. The only exception to that, of course, is people who are living in a household with a positive case. If you're living with a positive case, then the whole household will do a 14-day quarantine period at this point. We're not changing that for the foreseeable future, but I'm delighted to minimise the impact, not only on the individuals, of course, with over 60,000 primary close contacts caught up in these positive cases, significant numbers of those, if they're fully vaccinated and they're not living in the same household as a positive case, they'll be able to move to a 7-day quarantine period. That'll also really, I think, significantly help businesses as they start to resume operations as we see a reduced impact of workplace exposure. With that, I'll hand back to Minister Pulford for any questions.